Welcome to Psychoanalysis You, the official podcast of the American Psychoanalytic Association. I'm your host, Dr. Gail Saltz. I'm a psychoanalyst, an author, and director of the Communications and Advocacy Department at APsA. The American Psychoanalytic Association is the largest U.S. member organization of professional psychoanalysts, and this podcast will highlight the work of various member analysts and how that work can be of use to you in your day-to-day life. My guest today on Psychoanalysis You is Dr. Alexander Kalogerakis. He is a clinical associate professor of psychiatry at the Weill Cornell Medical College, where I am as well. He is vice chair of the American Board of Psychoanalysis, and he is also a member of the New York Psychoanalytic Society and Institute. But he is a child and adolescent supervising analyst. He's a member of the United Nations subcommittee of the International Psychoanalytical Association. Welcome. Thank you for joining me today.
Thanks for having me.
So we have not spoken on this podcast about child and adolescent psychoanalysis, and I think many people are interested in how one could do psychoanalysis with a child or even an adolescent for that matter. So I'm excited to have you here today and get to the bottom of all that and help people understand a little bit more about your practice and the theory behind psychoanalytic treatment in children and adolescents. So let's start at the beginning, which is really parents have a child who's having some sort of difficulty that becomes evident to them. And my question is really, how would a parent decide that the nature of this difficulty warrants a visit to a psychoanalyst as opposed to some other type of treatment?
Sure. Well, it's a great question. And because there's such a range of options available to parents and families today, in terms of the kinds of difficulties that may bring a child or adolescent, and sometimes when I say child, I'll be meaning both just for shorthand purposes, but may bring parents with a child to see an analyst, really covers the range of psychopathology of children and is not limited to particular areas of, say, cognitive or emotional or behavioral functioning, but really can cover all of that. And what's different is the approach. And especially now where there are many short-term treatments available and behaviorally oriented treatments, it's not uncommon that kids who do end up getting an analytic treatment may have had some previous more symptom-focused treatment. So that's one thing, that often parents and their kids have had some difficulties and have gotten some help with it. And maybe that has, been good as far as it goes, but that it may not have addressed some of the underlying or ongoing issues that would yield ultimately a fuller, better result. And child analysis, as you know real well, Gail, like adult analysis, it's not a short-term treatment. It's also not a quick fix treatment. So that in a way, the goals of child analysis are more ambitious also than a lot of short-term treatments would be, because we're trying not only to help the child and the family with the presenting difficulties, whatever they are, but also sort of build in positive psychological structure that will stand them in good stead down the road.
So a child might seem to their parent to be struggling with a lot of anxiety or a lot of fears. They might be having mood problems. And actually, I bring these two up specifically because, well, frankly, they're the most common in terms of difficulties that children do present with, but also because as of the last couple of years, I think particularly since the COVID pandemic, but really continuing on, we've just continued to see a rise in anxiety disorders and in mood disorders in children and in adolescents. So they might present to you and say, my the child seems to be having a tremendous amount of anxiety all the time. And I see whatever the symptoms might be, sleep difficulty, separation difficulty, a lot of worries expressed and harming their ability to function as well as they did before, or mood. They may seem sad often, struggling in that way. So, and sometimes you're saying you might have seen them get a short-term treatment, which helped them somewhat, but not entirely, I guess is what you're
Yeah,
saying. And so that might bring them in for this evaluation. What types of problems do you think respond the best to this type of treatment though?
right. Right. So, if you think about the range of psychopathology from maybe adjustment disorders at one end, which are really things that individuals experience as a result of clear environmental stresses, to psychotic disorders that we tend to think of as at least significantly biologically driven. Probably the ideal candidates for child or adolescent analysis fall on from leaving out the psychotic disorders but really the rest of the spectrum. So that covers, significant mood disorders, significant anxiety problems, character, personality difficulties. So there's a wide range. And again, one of the things that is sometimes the case is that a child may have had some symptomatic relief from another intervention, but that one thing we know is that symptoms, particularly in children and adolescents, can migrate over time and can evolve over time. So, for instance, a lot of kids who may have primarily anxiety symptoms prepubertally may develop a depression in adolescence. Taking the vantage point of an analytic treatment where we're thinking about what's the functioning of the mind, in this case of developing minds with kids and adolescents, and what are the things that we can do in an intensive treatment that can make that more sturdy, not only to handle the immediate issues that are distressing, but the slings and arrows of life that may follow. And that's a way that the treatment really differentiates itself from shorter term treatments. In answering to your first question, though, often the less intense treatment may have been carried out by the same practitioner, right? In other words, most young people who I end up seeing in analysis don't start from day one in analysis, right? So we'll often try, a less intense intervention, which might be a psychodynamically minded psychotherapy, maybe with some cognitive behavioral pieces thrown in, maybe some environmental manipulations helping the parents, help maybe a school intervention. And sometimes that's good enough, but many times it's not.
So you do that. You're a psychoanalyst, but you use these other models at times as you see maybe is important in the moment early on, or as you said, maybe enough. Tell us a little bit about this child shows up, you're going to do an evaluation. What are the symptoms? What is the parent seeing? What is the history? What does the trajectory of this look like? As any practitioner would. How does this evaluation for an analysis, let's say, and then go on to explain how analysis itself in a nuts and bolts sort of way, how do you use the theory of psychoanalysis, which in an adult is very much about the importance of free association, maybe not looking at the analyst, is about dream analysis, is obviously all with the understanding that you're trying to understand, help the patient see what's unconscious, maybe driving thought and behavior, make it conscious and work from there. But in a child, maybe those aren't the techniques, maybe those aren't the strategies, but the principles may still be the same. So how does that look when you're evaluating and then treating?
Right. So the second part of your question is sort of, what do you do to engage the issues that we think about in adult analysis and the processes? And the first part about the evaluation consultation phase, part of that is also assessing whether a child has the capacity to engage in this kind of therapeutic work. So practically speaking, usually evaluations are not concluded in one session. We meet with parents, we meet with the child individually. We may meet with parents and a child together. This is all in terms of gathering information. So as you said, just like any good clinician, we want to learn about environmental factors, about biological factors, about school issues, if the kid's in school, the whole range of functioning that's relevant to healthy life. And as I'm doing that, I'm trying to narrow down where might the problem lie. So if a kid is fearful about something like a phobic symptom, is there an immediate precipitant to that? Something that happened? Okay, well, sometimes there is. But often there's more to it than that, because we know that if 10 kids or 100 kids are exposed to something that is on the traumatic spectrum in some way, not all of them are going to react the same way, right? So, and one thing about an analytic evaluation of a person, young or old, is that it's very individualized, right? So I'm going to be looking not only for an antecedent to the symptoms that may be pretty obvious, but also antecedent to the antecedents, right? What about the youngster's functioning or the family dynamics or whatever it is might make this particular youngster more vulnerable to becoming symptomatic, say, with some external event. We're also, I mentioned family dynamics, we're very tuned in to what actually happens in a family. And in adult psychoanalytic work, usually the family resides in the patient's mind, right? It's the versions of parents that we all carry around with us. For children, and definitely adolescents too, parents and siblings are not only internalized versions of those folks, but also real people that their kids are interacting with all the time. So we're very much thinking about how does all that work in a given family. And then we think about if and how a child can participate in a more exploratory dynamic therapy or analysis. So we might do some drawing in a consultation session. We might do some play with puppets or superheroes or whatever could be another way for a child to express him or herself. And which gets us now to the second part of your question, right? Because, yeah, I have a couch, it's over there. Adults use it to lie down. Children use it to jump on or to take a nap on or, whatever, to build a fort with. So children are not going to free associate in the way that adults do. But there are things that we provide as part of the office setup to help children express themselves in however they best can at their developmental level. So that can include things like drawings, play figures, sometimes more organized games, anything that helps you reach a child and allows you to foster a sense of safety that allows for expression of what's going on for them, including in displacement, right? Which is a big part of working with kids in a way that's a little bit different from adults.
So certainly for a younger child, maybe for an adolescent, you are talking.
You're talking, yeah.
And you are listening as you do for an adult for connections of something that may be out of their awareness that you can ultimately explain to them in a way that we call an interpretation of sorts.
Right.
But with children, you do use play, as you said, you use drawing, use storytelling, the way that they can communicate, that you use their forms of communication. Do you talk about dreams in work with children, with adolescents?
Sure. It's interesting with adolescents, depending on where they are and what they've been exposed to. Sometimes adolescents love the idea of telling you about their dreams because it's sort of mysterious and maybe a little fanciful, but also oftentimes at any age, you wake up from a dream and you feel you've had an affective experience. And so that could be very powerful. And in some adolescent patients in analysis, dream work can be very prominent and in many ways similar to working with an adult patient. With younger children, sometimes you hear about their dreams from their parents, right? Because the child gets up in the middle of the night, runs into the parents' bedroom and says, a monster was chasing me, or some such exciting event. And then we might hear about it secondhand, but we can use our judgment and, bring that into the session with the child. Or there are times when children I remember one of my first cases a long time ago, a kid fell asleep on the couch, woke up 5 minutes later with a dream. Now, was it a dream in the sense of REM sleep? I have no idea, but it was a product of that child's mind in that particular moment. And, we could talk about it.
So another cornerstone for psychoanalytic theory and treatment is that of transference. And adult patients, you can experience the transference. They experience the transference. You experience your countertransference. And then that's something that you would talk about in the treatment to understand, but explaining to the patient at the same time how this is really a representation of other important relationships, therefore data about whatever they're suffering with. What about children? How does one work with transference in children?
Right. Yeah, it is more complicated in a way with children. And in other ways, sometimes actually less so. What I mean is that many kids, and particularly adolescents, don't want to talk about you. They're not so interested in you, and not on a superficial level. They're interested in their friends and their families. And so it's in a way less typical than with an adult patient, where the transference would be a front and center part of a treatment in a direct way. But that being said, so going back to play often can reveal transference themes, right? Because if a child is playing here, I'm usually playing with them, and I'm going to have a role in that game, which is usually assigned to me by the child. Depending on how that's going, I may put myself in there, but usually it's the other way around. Already you can imagine that the characters in the play are representative of all sorts of things. They're representative of the child himself, him or herself, maybe a sibling in the family, maybe a friend that they had some encounter with the other day at school. If it's an adult character, obviously that could refer to parents, it could refer to other important adults, could refer to the person of the analyst. So in the displacement, and there are technique issues in child analysis about how much do you interpret within play versus outside of play, how much do you make the connection between reality and the play. And most often, at least for a while, you let it stay in the play, but you can offer interpretations that way. I wonder if character so-and-so was feeling this when this other character said such and such. And so that it's alive, it's in the language that the child understands, but it's also a little bit removed from the reality or direct communication so that it's tolerable. The other thing what I said, sometimes it's easier, is that for some children, and this may be more true of the sort of 4 to 7-year-olds than the middle childhood latency age, kids just say things. And kids will just be very blunt. I hate you, or can you come home with me? Now, these are still statements that are on the surface of the material, right, that you want to get further with, but they're very direct and effectively alive. So it's, in that sense, it's easy to say, oh, okay, well, what would you like if you could take me home? Or how would you feel if you did hit me? And so again, depending on the developmental age, sometimes the things that we think of as more hidden in adult work and needing to be sort of worked out gradually, sometimes are right on the table.
Can you talk a bit about two things? One is sort of, is there evidence out there? This has always been a challenge for psychoanalysts and the field in general, that psychoanalytic work, I'll say, psychodynamic work, psychoanalytic work helps children and adolescents. And also, along with that, really, any explanation of, do we know how? Do we know how this is working and really does help?
Yeah. Yeah, it's great questions. In terms of does it work and what's the evidence basis for that, there are a range of studies. And I'd say the broader picture would include psychodynamic psychotherapy along with psychoanalysis proper. Psychoanalytic psychotherapy, usually less frequent, maybe once or twice a week, but based on the same principles as psychoanalysis and really derived from psychoanalytic theory. It's as is true with adult work, it's easier to study things that are shorter and quicker than that are long. And so analysis suffers somewhat because of that. But that being said, there's a wide evidence base at this point for psychodynamic treatments for children. There are manualized treatments that are short-term. There are more open-ended psychodynamic treatments. There's psychoanalysis itself. I mean, one recent survey I found over 20 randomized controlled trials of psychodynamic therapies for children. That's a lot. And if you include things other than RCTs, like chart reviews and other kinds of studies, there are over 100 easily. There's a review article that summarizes a lot of this material from 2021 in Frontiers in Psychology, and that looks at, they compiled, I think, over 150 something like studies that in a broad swath show the efficacy of these treatments. There also have been some, not a whole lot, but some studies that try and look at actually differences between psychoanalytic therapy and psychoanalysis proper. The best known of these comes out of the Anna Freud Center in London, formerly the Hampstead Clinic. This was a series of articles that came out. Peter Fonagy and colleagues did this work there. And interesting findings included that in many instances, more intensive analytic treatment was superior to psychodynamic therapy, both in terms of positive associations to length of treatment, but also to intensity of treatment, even holding the length constant. And this is something that's valuable to me as I think about talking to parents, for instance, about, do you really want to invest in this intensive treatment? Because I think it's fair to say, based on this study and similar, that if your child's going to be in treatment for a year, let's say, which is kind of short in analytic terms, but still, if they're in an analysis and they're suitable for analysis compared to a psychotherapy, more is going to happen in that same year, right? And you could say the same for 2 years of treatment. So again, it's a more ambitious treatment, but there's evidence to show that it accomplishes more. The other thing that the Anna Freud Center studies showed was that it's particularly useful. The positive associations are stronger with under 12, with prepubertal, than with adolescents. And across all ages under 18, stronger with more complex clinical presentations, right? So, which kind of makes sense, because if you think about the analytic theory and mindset as a practitioner, you're not just focused on one set of symptoms. You're thinking about, in one of our languages that we use, ego strengths and ability to resolve internal conflict and things like self-reflective capacity, right? And we're thinking about all those things because we know that all of those not only affect symptoms, but also affect development.
So in a sense, you're saying the way that it works is enhancing that child's ability to self-reflect, to experience their emotions and be aware of their emotions and be able to manage them through the knowledge of it and the safety of the office environment where they learn how to do that, and to struggle with things that, I guess, in a sense, you're saying shape future development and make them really develop a certain kind of resilience, I guess, emotional resilience.
Yeah, absolutely. If you look at the resilience literature, I mean, some of the things that this is like general psychology stuff, but improved strengthened relationships helps resilience, self-reflective capacity improves resilience. These are things that are overt goals of psychoanalytic treatment. And with children, you mentioned insight as one thing that we think about a lot. Alan Sugarman, who's a child analyst in San Diego, has written about insightfulness as a concept, as something that may be more relevant to work with children, that it's not that necessarily there's an aha moment that will sort of lead to the successful outcome of a case, but that we're training up these capacities in our child and adolescent patients. Also very similar to Fonagy's mentalization approach, right? Which is another short-term dynamic treatment that's been studied quite extensively.
So as you allude to, there may be parents who are like, this does sound like something I'm interested in. Most often, I think a parent that comes in and really does express interest has been aware for some time that their child is really struggling and they're struggling with their child. And actually, I think statistically, the numbers are like 3 to 5 years between first presentation of child symptoms, mental health symptoms of some sort or another, and any sort of diagnosis and treatment. So it's often by the time they come to you, or anybody for that matter, it's been a long time. But you are talking to them about something that is not 8 to 10 sessions and then we're done. This could be costly. This could be difficult to work into a child's schedule, a parent work into a child's schedule who has to bring the child and so on. Can you talk for a minute about access? And I mean, access has many, there's the economical access, but there's even just finding someone. I mean, in many parts of the country, there aren't that many of you. There aren't too many child and adolescent mental health treaters in general, or psychiatrists or psychologists, but certainly psychoanalysts. What can a parent do who's thinking about this, but thinking, oh my gosh, this just seems overwhelming. I don't think I can do it.
Yeah. It is true that there are geographical disparities, and like with many medical or health services, they often concentrate in big metropolitan areas. That's certainly true with analysis. But, I think one thing that some of us who have this training are able to do is also to offer supervision to people who don't have the full training. I've been supervising, as I think many of us have who trained at Cornell, supervising child fellows for many years. So even though most of them will not become child analysts, they know something about how to think analytically with children. And even there are consortiums that work across states to do this sort of thing. So that's one piece of it. In terms of access, you mentioned financial. Of course, any treatment that takes up a lot more time is inevitably going to also have a cost associated with it. What's very fortunate is that in most training centers, and we can start from our sort of analytic alma mater at New York Psychoanalytic, there are both low-fee treatments are available, often with a trainee. And again, the trainees are usually folks who are completely trained in a primary specialty like psychiatry, psychology, or social work. So these are not green practitioners, but are learning a subspecialty essentially. So that's one thing that's really terrific, that most analytic institutes all around the country have low-cost treatment available. In addition to that, the American Psychoanalytic Association has a candidate assistance fund. The ACP, which is the Association for Child Psychoanalysis, which is a separate group including APsA and non-APsA trained analysts, also has a fund named after Anna Freud that can subsidize people to do analytic cases. And many local institutes like ours actually have a fund that can help a candidate or even a recent graduate who's interested in doing more analytic work can be partly subsidizing that treatment so that the out-of-pocket cost for the family is reduced.
It's great to know. So people could contact a local institute or the American Psychoanalytic to explore those ideas.
Right. For the institutional funding, it's the clinician who requests it, but it can enable the low-fee treatment. Right.
And many clinicians do actually offer a sliding scale treatment if you talk to them about it, what you can afford. Some will absolutely do that. And what about parents? Because as you said, this is not like an adult analysis where you never see them because you're really talking. You don't want to see them. You want to just understand how they feel about these important performative family members. But this is very different. I know in the evaluation, you talk to parents, but as treatment goes on, are parents involved? What do you talk to them about? What do you expect from them? Is there direction to the parents? Are they really like part of the treatment?
Yeah. In general, the answer is yes, they are part of the treatment. There is a developmental curve to that in the sense that for teenage patients, there's going to be more variation in how parents are part of the picture because as we all know, teenagers often are in a process of individuating and separating. And so that from the point of view of the sense of privacy and safety of the analytic communication, it's sometimes necessary to have fairly minimal contact with parents. But that does vary quite a bit with the individual. And there are early, middle, even some late teenagers in their later teens who welcome and are comfortable with that. And it can provide another source of information about the patient's life, which is, if we go back to the younger kids, that's one of the important functions of working with parents. Little children are not great historians. They don't need to be. It's unusual if they are. So there may be things happening in the family and their social worlds and so on that you just won't hear about. And you may see echoes of it in the play, but maybe you're not sure what actually happened. And sometimes it's good to know what actually happened. So to me, meeting with parents, both in the consultation, but in an ongoing way, has a very important informational aspect. What's going on in this child's life that I may not be hearing about? Then beyond that, from the parent's point of view, and this is, I think, really crucial, is that I see part of my role as a child adolescent analyst as to helping parents understand their child, right? And doing that without betraying confidences in a more general way, but really helping parents to think through the questions that are on their minds anyway, about why does my child behaving like this? How could he have said that to me? Why is it so variable? This week is terrible. Last week was great. And in a way, we're trying to add to parents' sort of armamentarium of how to think about what's going on with their kids. Don't want parents to become their kids' analysts, but it is helpful to be able to step back sometimes as a parent and think about it in a way that goes beyond the parental necessities of setting limits and guidelines and just making things happen, getting the kid out the door in the morning. So regular work with parents, which, at a maximum would probably be once a week. So if you're seeing a child 3 to 5 times a week in an analysis, you might see the parents once a week. But it could be once a month. There's a range. Part of the purpose of that is also really to help them think about their son or daughter in a way that gives them another option besides the sort of default go-to. And it's not, one thing maybe I should say that it isn't, it's not necessarily about giving advice. There are all sorts of books at Barnes & Noble that give advice to parents. I don't need to cover that. But seriously, the reason is I find it's much more helpful to help parents think things through as to how to approach something and why to approach something a certain way in terms of their parenting than to say, try this. Sometimes we do that.
But a goal, ultimately, you're sort of describing is how they can have a better emotional relationship with their child
Yeah.
as their child grows up.
Yeah, right. If you can be empathic with the child in the way that keeps you on the same side, even though you're still maintaining distinct roles as a parent and child, you're much more likely to get further with whatever the issue is. That's not always possible. Sometimes it has to be done like after the fact, like you've had a big argument one night and maybe the next day things have cooled down. But then the chance to think about it in a different way and try and see it somewhat from the child's perspective can be such a powerful tool that I think parents are capable of, but can sometimes use some help to activate that within themselves. So in some ways, it's like a supportive therapy for parents. We're not trying to do a parallel analysis, but it's sort of trying to enhance the parent's strengths through a deeper understanding and emotional connection with their children.
So then you mentioned a year earlier as an example of how a child might be in treatment. You said, of course, that's not a long treatment. And of course, for an adult, that would definitely, in analysis, that would definitely not be.
Speed analysis.
But, but I imagine child analysis is probably often shorter than an adult analysis. So how do you decide, like what kind of time frames are we talking about? How do you decide you're ready to be done?
Yeah, right. That's a great question. And there's a whole literature on termination and child analysis that features some different ideas than an adult. One of them being, is the child at a place where you can reasonably predict that whatever the upcoming developmental challenges are, puberty, going away for school as a young adult, or the intense social scene of adolescence, whatever it might be, or from a young child going into first grade after playing all the time in kindergarten and preschool, right? If you have a sense that the child has come along enough and has developed this sort of emotional sturdiness to weather the predictable challenges coming their way, that's one way to think about it. Ideally, it's a three-way process, parent, child, and analyst, and that there's some consensus around that kind of issue. Doesn't always play out that way. Sometimes reality factors, got on the travel soccer team, right? There are all sorts of things that can come up, but ideally you want to feel that not only has there been symptomatic relief, which is sort of the first reason that people are coming in the first place, but also that the child has made strides in terms of development, ego strengths, if we use that model, and capacities and interpersonal functioning and so on, that all those are sort of lining up in a way so that it's not that everything is solved necessarily, but that there's enough good direction there that will help them. And that's really the primary goal of child analysis, as opposed to some more symptom-oriented treatments. It's the resumption of normal development.
So getting them back on the track that you wish they would have been on. So, okay, we've moved through treatment, and to finish for us, psychoanalytic principles are used all the time in our world in what we call an applied way to understand all of the whys of human nature and what goes on. And this must be true for children as well. And you serve on this United Nations subcommittee of the International Psychoanalytic Association. And I wonder what issues you work on there. Does the committee look at how psychoanalytic principles can be for children, can be used in a broader sense?
Yeah, that's something that I've been involved with for 10 or 15 years now. That's very interesting because the UN is oriented towards improving the lives of the world in all sorts of ways, of human rights and economic development and many sort of big picture items. What I do as part of the IPA subcommittee that interacts with the UN, where we have an NGO status essentially, is to try and infuse those discussions with things like, what are the psychological needs of children? What are the things that can interfere with that? There's a big literature nowadays in academic psychiatry and psychiatry on ACEs, adverse childhood events, and how those correlate with later psychopathology and so on. And this is something we know about because of our developmental framework that we use in analytic thinking. Through different kinds of interactions, analysts can participate in symposia that the UN puts on, or certain groups within the UN do. We collaborate with other NGOs, for instance, on groups that are interested in migration, which obviously can be traumatic in many circumstances, or terrorism. I've done a number of talks and participating in symposia where we're looking at a problem that the UN is interested in terms of social benefit for its member states and populations, but from an analytic point of view. Things like the recruitment of children into as child soldiers, or human trafficking, problem of weapons and violence in societies. All these things can be thought about through an analytic lens. So we try and get that out there into the discourse of the UN.
By educating people who are, I guess, on the front lines of trying to design policy,
right,
or economic aid for that matter, to change what is happening or making recommendations to make them informed so that they can use that in that policy set.
Yeah, and even things as simple as for families who may be in some transitional state in the world with migration or warfare, how about some access to mental health care? People will think, yes, there needs to be general health care, but what about mental health care, right? Because that is clearly, there's so many vulnerable populations, and the more we can do. Another thing, we're talking about resilience before. Another factor in resilience is having a strong connection with a caregiving adult. Usually in early life, that's going to be a parent, but at different points in life, that can be another person too. It can be an aid worker who's a real presence and can be trusted. This provides hope, it strengthens resilience, and so on. So we try and help people who don't usually think about these sorts of things, diplomats and aid workers, to keep all this in mind.
It does seem like it's relatively new to the world, amazingly, that the idea that mental health is health, and that poor mental health affects physical health, that many of the countries with, as you're bringing up, trauma, difficulty for children, have also then permanently burdened adult population that ultimately is more costly than had there been intervention early on. These sorts of issues, it seems so important to educate people who are in a position to do something about it if they understand it. That's wonderful. As a psychoanalyst, you're in a position to be able to impart that sort of information on a wider scale. Well, I really appreciate you joining me today, and I think explaining in a granular way what a lot of people find to be kind of mysterious. And I think people should know that the American Psychoanalytic has a list of members who are child and adolescent analysts. If you need to find someone in your area, there is a members list that makes it possible to search for who is accessible. And there are many ways to get more information actually about child and adolescent psychoanalysis if someone is interested. I thank you so much for joining me today. As a colleague, I'll look forward to seeing you sometime soon, I'm sure.
Yeah, seeing you around the neighborhood. Great to talk, Gail.
Thank you. Thanks
for having me.
Thanks, Alexi.
And now for some Freudian quickies. You sent in your questions for an analyst, and I grabbed an analyst with an answer.
Will there ever be a Freud bot? How might it work? Gosh, I hope not. What matters to me in psychoanalysis is the human connection. If there were to be a Freud bot, it might be very frightening in that probably AI can generate many competent interpretations and even to a certain extent something that seems like empathy or evenly hovering attention or some kind of active listening. I think there's something quite horrifying in the idea that someone would spend time talking to a bot rather than investing in relationships.
Will there ever be
a Freud bot?
You have to ask ChatGPT that question. Okay. I mean, my corny response.
What do you think it might say?
It would ask something deep about what happened to you as a child. I don't know.
There certainly will be a Freud bot because that is how technology works and innovation works and our society that is, for better or worse, based on capitalism work. Somebody will try to find a way to make psychoanalysis more efficient and technologically friendly and accessible. Those are not bad things. But the Council on Artificial Intelligence and the American Psychoanalyst and the publication of APsA have had articles on the limitations of AI, specifically around the importance of having had a childhood, which artificial intelligence doesn't have, having a body and the experience of world that is embodied. These are things that AI is unlikely to ever be able to achieve, and why having an actual human being as part of the psychoanalytic experience and self-understanding will always be important. That's not to say that technology can't help us with mental health, but there are limits to what it can do.
Name a psychoanalytic value and how it's useful in treatment. One of the most important psychoanalytic values is the ability to hold complexity. The problems people encounter in life are often complicated. They have many threads. Holding complexity means being able to look at many threads at the same time as a way to untangle them and make better sense of one's experiences.
If you have a question, really any question for a psychoanalyst, send it to APsA Podcast at gmail.com, and we will try to feature it in a future Freudian Quickie. For more information about the American Psychoanalytic Association, go to www.apsa.org. Till next time.